Hey girls, Nicole here with Royally Fit. Today I'm going to talk to you about Diastasis Recti, how to check for it, some of the ways women develop it, and a couple different ways to help strengthen your core, your overall core strength, because that will help rebuild your core, which after pregnancy has been rocked a little bit, let's say. So Diastasis Recti is when the left and the right side of your abdomen separate through your linea alba, which starts right at your rib cage and all the way down to your pubic bone. So some of the signs that you may have developed diastasis recti during pregnancy is you might get a tenting of your stomach. You might have a dark line that you'll see right down your stomach. Some women experience some discomfort in it depending on how much their abdomen wall has separated. Some people don't even know that they've had it. I've tested some women a couple years after and they still do have minor separations. So it's nothing to worry about, easily corrected. Depending on how big your separation is, you may need to seek help and advice from your doctor. There are specialists that really work on bringing your abdomen wall back together. So I've just got a couple moves that if it's not separated very much, you can work on these at home. Okay, so you can't avoid this. If you get pregnant, you are at risk, if you will, of developing this. If you're over the age of 35, you are at a higher risk of developing it. Doesn't mean you will get it. Also, if you have rapid weight gain, either yourself or with your baby, because basically everything's pushing out so quickly that your abs don't really have a choice but to separate to help make more room for all your organs and the growing baby. Okay? So how we're going to test for this is you're going to lie on your back. Pardon me. You're going to have both feet flat on the floor. You're going to put one hand behind your head and crunch up. So you're supporting your neck here. That's one of the main purposes of doing this. You're then going to take your free hand, start up right between where your ribs meet, and you're just going to walk your hands down. You'll feel where your abs connect there. You will feel a divot. So you're just checking to see if you can get a finger in there. As you move down your stomach, you might feel it separate a little bit more around your belly button. If you're wearing thicker pants, please roll them down so that you can really test all the way down. I haven't had a baby and I haven't had rapid weight gain, so I don't have any separation in mine. Most women, I find it's in and around the belly button area that you will start to feel it. It is a weird feeling to be sticking your fingers into right between your abs. So if you've got 1 to 2 fingers, you should be fine. If you have concern, go see your doctor. If you're 2.5 to 3 fingers, that is a little bit more severe. So please go speak to your doctor and get some additional help from a specialist that works specifically with this. Every region has them. And it's easy to correct, don't worry. So what you're going to do to help work on your back and your core strength is you're going to lie on your back. So this is great post-pregnancy. I do this with all my postnatal women. Everyone can have a six-pack, but if you don't have a strong core, it doesn't even matter. So we're going to work our transverse abdominals, which start right at the back of your spine, work their way around to your stomach. They're what gives us form. They're what helps us keep our back nice and strong. I challenge you, do this every day, 30 seconds to a minute. If you have back trouble, you will not have back trouble in about a month if you're diligent on doing this every day. So what you're going to do is you're going to bring one leg up, roll your hips towards your ribs. So your back should be totally flat against the floor. You're going to raise both legs, keeping that back totally engaged, and you're just going to hold it here. Another way you can try doing this is start with your knees closer to your chest. Make sure your back is nice and flat, and then slowly bring your legs out together until you feel your back pop. You can put your hands underneath to try and make sure that you've got that security and that push down in your back, and you're just going to hold it right here. Okay? Doesn't look like much, burns like crazy. Okay? If you need to take a break or if you feel your back weakening, just come out of it, give yourself a little bit of a break, and then try it again. Okay, work yourself up to a minute. Another one you can do is V-sit contractions, and you can do both of these pregnant or not, or postnatal, or if you're not even pregnant, or postnatal. So these are really great to work on. So what you're going to do with this one is have both your heels on the floor. You're going to sit up nice and tall. We're going to be doing V-sit ab contractions. So what you're going to do is you're going to curl in. I like to use my hands as a visual. Curl in, pulling that belly button all the way towards your back. And you're just going to hold it for a second and then release up, straightening your back. Pull it in. Feel that crunch. You're basically doing the sitting crunch and then release. Okay? Pull it in and release. So with these moves, you're working those transverse abdominis muscles. Plank is really good to be working on this. However, plank is more advanced. If you do have a weaker back, not everyone can hold a plank. So that inverted chair or dead bug, that first one I showed you, that is a great one to do. If you have weak shoulders, perfect for you. Okay, so work on those. You can also work on side plank. So you can come down onto your elbow. Make sure your shoulder's right over top of that elbow. You can do this from your knee. Make sure your knee is in line with your hip, which will also be in line with your elbow, and get your hip up nice and high. This will also work that oblique area and transverse abdominis. If you do have diastasis recti, plank is not the best because it does push everything forward. So you can imagine if you already have a separation and you are now in a plank position, gravity is going to pull, it's going to sound gross, it's going to pull all your insides and put a lot of pressure on the opening. So you don't want to put that pressure on it. That's why being on your back or sitting up, contracting everything in is a great alternative. Okay? So if you have any questions, please feel free to ask away. I love talking about pre and postnatal help with women. I suffered from back pain, so I've been working on my back like crazy so that if I ever do get pregnant, I've hopefully got a nice strong back to support that little one. Okay, so thanks very much, and we'll see you soon with some more help with your back and other body parts. Okay, bye.